Understanding Arrhythmias, a comprehensive guide. Have you ever felt your heart skip a beat or flutter unexpectedly? It might not be just stress or butterflies. It could be an arrhythmia, a disorder of the heart's rhythm. Arrhythmias occur when the heart's electrical signals don't fire normally, causing the heart to beat too fast, too slow, or irregularly. Sometimes these rhythm hiccups are harmless, but sometimes they're a big deal. They can lead to dizziness, fainting, or even life-threatening issues like stroke, heart failure, or cardiac arrest. In fact, experts warn that 1 in 3 people worldwide will develop a potentially serious heart rhythm disorder in their lifetime. That's huge. Yet awareness of arrhythmias remains critically low. Today, we're diving into the world of arrhythmias, or heart rhythm problems. An arrhythmia happens when the electrical conductor, a small area of the heart called the sinus node, misses a cue or fires off beat. The result? The heart's timing goes off. It might speed up, slow down, or beat irregularly out of sync. In plain terms, arrhythmias are abnormal heart rhythms. Types of arrhythmias. They are broadly classified based on their speed and origin. 1. Atrial fibrillation. Most common arrhythmia worldwide. Atria quiver instead of contracting properly, causing irregular, often rapid heart rate, 100-150 beats per minute. It affects approximately 1 in 3 people over age 45. Symptoms includes palpitations, fatigue, shortness of breath, or none at all. Complications includes clot formation leading to stroke. Can be of paroxysmal, persistent, or permanent type. 2. Bradycardia. Resting heart rate of less than 60 beats per minute, often normal in athletes, problematic if too slow for normal function. Symptoms includes dizziness, fatigue, fainting, caused by sinus node dysfunction or heart block. Severe cases may need a pacemaker. 3. Tachycardia. Heart rate is more than 100 bpm at rest, not from exercise or stress, caused by electrical issues and has 3 types. Supraventricular tachycardia, rapid rhythm from atria or AV node. Sudden onset in young people. Symptoms includes pounding heart, dizziness, can be stopped with vagal maneuvers, for example coughing. Ventricular tachycardia originates in ventricles and occurs often in people with heart disease. Symptoms includes fainting and collapse. May require urgent treatment as it can lead to ventricular failure. Atrial flutter comprises of organized fast atrial rhythm of around 300 beats per minute and often gives a heart rate of approximately 150 beats per minute. Ventricular fibrillation, VF, chaotic quivering of ventricles due to non-effective pumping. It's a medical emergency leading to sudden cardiac arrest. It requires immediate CPR and defibrillation, and is one of the common cause of sudden cardiac death. Premature beats, PAX PVCs. Extra early beats in atria or ventricles. Feels like skipped or extra beat. It is very common and often harmless. Triggered by stress, caffeine, sleep deprivation. Frequent or symptomatic cases may need treatment. Each arrhythmia has unique risks and presentations. Some require emergency intervention, while others need long-term management, like atrial fibrillation, and some are benign, like occasional PX. Detecting and treating them early helps prevent complications such as stroke or cardiac arrest. Latest global statistics, 2023-2024. As per European Heart Journal, atrial fibrillation affects over 60 million people globally. And according to American Heart Association Journal, atrial fibrillation is linked to a 5 times higher risk of stroke and 3 times higher risk of heart failure. The prevalence is increasing due to aging populations. Estimated 1 in 4 adults over 40 will develop an arrhythmia in their lifetime. Several factors can contribute to the development of arrhythmias. These include heart disease, high blood pressure, thyroid disorders, and diabetes. Certain medications, excessive alcohol consumption, and drug use can also trigger irregular heartbeats. Sometimes, arrhythmias occur in otherwise healthy individuals. Genetic factors can play a role, as can stress, anxiety, and even excessive caffeine intake. Identifying your personal risk factors is crucial for prevention and early detection. Symptoms of arrhythmias can vary widely. Some people experience no symptoms at all, while others may feel palpitations, fluttering in the chest, or lightheadedness. Shortness of breath, chest pain, and fainting are also possible indicators. Diagnosing an arrhythmia typically involves an electrocardiogram, or ECG. This test records the electrical activity of your heart. Other diagnostic tools include Holter monitors, event recorders, and electrophysiological studies. Prevention includes 1. Manage risk factors, for example, high blood pressure, diabetes. 2. Avoid excessive caffeine and alcohol. 3. Quit smoking. 4. Regular moderate exercise. 5. Maintain a healthy weight. 6. Treat sleep apnea. 7. Reduce stress. Treatment for arrhythmias depends on the type, severity, and underlying cause. Lifestyle modifications, such as reducing caffeine and alcohol intake, can be helpful. Medications like beta blockers and antiarrhythmics can help control heart rate and rhythm. In some cases, more invasive procedures may be necessary. These include catheter ablation, which destroys the abnormal tissue causing the arrhythmia. Pacemakers and implantable cardioverter defibrillators, or ICDs, can also be used to regulate heart rhythm and prevent sudden cardiac arrest. Living with an arrhythmia requires careful management and monitoring. Regular checkups with your doctor are essential. Adhering to your prescribed medication regimen is also crucial. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can significantly improve your heart health. Learning to manage stress and anxiety is also important for preventing arrhythmia episodes. Remember, with proper care and attention, you can live a full and active life with an arrhythmia.